Currently, right now, our hospitals are at 97% capacity of their COVID beds. And dozens of folks are showing up every day. The field hospitals are ready, but what we want to do is avoid rationing beds, limiting care, overwhelming the hospital, and turning off non-critical procedures. So the plan that we have includes opening the Cranston Field Hospital and the Convention Center. But I want to say this, if the system gets overwhelmed, if we just have too many people too quickly, then our backup option is to make beds available by clearing out other beds in the hospital, which means shutting off other important procedures. You know, we think of them as quote-unquote electives, but these are important procedures that we would have to cut off. Heart surgeries, brain surgeries, preventative care, cancer screening. Every doctor will tell you that they're seeing more developed cancers now because people canceled their screenings in the spring. So we want to avoid all of that. Dr. Alexander Scott literally is up at night afraid that we're going to have to go to crisis standards of care. And what does that mean? I'm not trying to scare you. I'm just trying to tell you the reality of where we are. The hospitalizations today are increasing at a faster rate than they were at our peak in the spring. Lifespan and Care New England are doing great work. Our Cranston Field Hospital will be ready for next week. The Rhode Island Convention Center Field Hospital will be ready by December 1st. Currently, with our cases, we're on a path to open Cranston and need it by the week after Thanksgiving. And we've been working very closely with Lifespan and Care New England, where we have certain triggers and it's in their capable control on when they decide to open the hospital and start funneling patients to the field hospitals. Due to the Herculean efforts of the building trades and so many people, we got the hospitals built quickly in the spring. We have 900 beds. The hard part's staffing them. It's the staffing. There's massive shortages all over the country. And people are tired and burned out, frontline healthcare workers. So it's the staffing where we'll get into trouble. And what the hospitals are doing now, to give you a flavor for how we're going to figure out how to staff, they're reassigning staff, working with colleges and universities to engage student nurses, student doctors, medical students. Gonna have to engage outsourcing some healthcare professionals, onboarding new employees in partnership with Skills for Rhode Island. But I want to be clear, this is going to be really hard. 97% of our COVID beds are filled. And our cushion, if you will, the way we get beds quickly if we overrun our field hospitals is to start shutting down other procedures at hospitals.